Hi, Pablo. Good night.
Hi, Doctor.
Can you hear me?
Yeah.
Yes, well, I'm sorry for letting you stay a little bit alone, but now I'm here.
Don't worry.
Let me see. Did you have enough time to finish the homework file I sent yesterday night?
Yeah, it was really tough, but I kind of did. I don't know if it's good, but it was really
Well,
tough.
so the objective of this is to practice together, right?
Yeah.
Okay, let me send the option. Oh my God, ¿dónde está? The option to share a screen together, okay?
Okay.
So I don't know what's going on with my laptop tonight, but it's not opening properly the Zoom. That's why I'm with my cell phone at this moment. Let's try again.
Okay.
Let me see. I'm gonna. Okay, now you are the co-host, and it's possible for you to share a screen.
Okay.
Please share me your job. Is that okay for you now? Is it possible?
I am kind of. I can find it.
Okay, let's cross fingers. I hope my laptop opens the Zoom call. Well, as we are preparing our material, yeah, let me give you some details about the final test, okay?
Okay.
As you know, it's gonna be the next week on Thursday night.
Okay.
Same schedule as the previous test, okay?
Okay.
So in that way, we are going to have 2 hours again. We are going to consider 10 to 14 questions maybe with multiple options. Well, give me a second. Okay, with similar, hi Dina, with similar ways to answer. I mean, it's a very, very nice job.
Okay.
Of course, we are going to consider abbreviations from Module 1 and some pathologies that are supporting the job we got in this Module 2. And the slides when I was telling you about the important information, maybe vocabulary or paragraphs to check because of the review there should be. Well, of course, we're going to consider all of this, all of them, okay?
Okay.
Okay, great. Okay, let's read your job. Give me a second. I'm exchanging screens.
Okay.
Okay. Okay. Case report. Patient who was complaining about abdominal pain, diarrhea, and messes. The patient also mentioned that yesterday she consumed food on the roadside stall, which has a high chance of being contaminated. At the end, the patient says she feels somnolent and has oliguria. Okay, let's try to reorganize ideas.
Okay.
Can you stop sharing the screen? And please send me your job by WhatsApp now.
Okay.
Okay, writing exercise.
Excellent.
Yes, I got it. It's now here. Homework 4, it's opening. I hope. Okay. Okay, this is the the homework file I sent.
Yeah.
Diana, did you get your exercise done?
Hi, me. Sorry, I'm on shift, so I got like 15 minutes to be here, and I don't have it with me. Sorry.
Okay, no worry. Please try to write it down.
Yeah.
And according to the details I find, I'm gonna send you the feedback, okay?
Thank you.
Please stay with
Can
us
I
in order to
can I
check
stay
and
here?
just yes, stay. That's okay for me. Pablo, is that okay for you to check
Yeah, sure.
Thank you.
check your file, okay? Okay, great. Well, in this written exercise, we are talking about do you get the diagnosis of this patient?
It should be food poisoning with dehydration, right?
Yep. Gastroenteritis could be right.
Yeah.
Because, well, with food poison, you don't get these vital signs.
Okay.
Yeah. Okay, I cannot download your file. I don't know what's going on with my internet now. It's running mad. Well, we have to work a little bit on the case report.
Okay.
But I'm gonna send you the answer, an example how to fix it, because you are not in, well, you don't have to show me how to, okay, let's go with myself. You don't have to give me the patient explanation. It's better if you just talk me in medical terms. Just, I mean, a similar paragraph like Joseph Jones could be.
Okay.
Okay, I got your file from my cell phone. We are going to use that. My laptop is running mad.
Too
I
bad.
don't know what's going on with this. Okay, do you remember the order of the what happened with this? It's running mad, of course. Do you remember how we can share, well, how we give the information of the patient?
Yeah, we should be telling man and woman and his age, his occupation, and then telling about what he complained to us.
Yes. Okay, now you're checking my cell phone. Yeah, again.
Yeah.
Here you are. Let's rotate this. Fast. Okay, case report. A patient was complaining about, okay, you can send a patient who complained of abdominal pain with diarrhea and emesis.
Okay.
That started yesterday, and that's enough. That started yesterday. He or she, doesn't matter. He also complained of somnolence and oliguria. Enough.
Okay.
Yeah, she also complained somnolence and oliguria. You don't have to give me the information about the chance of being contaminated food. It's not necessarily at this point, but well.
Okay.
Physical exam, or fever, of course, or pharynx, pale, dry lips, and dry vocal mucosa. When you evaluate oropharynx, you describe lips and the oral mucosa.
No, what should I put there?
Yes, it shouldn't be there, but well. cardiovascular, respiratory system. Okay, could be abdominal, general spine during palpation, increased bowel movements, no muscle sense of peritoneal irritation. Okay. Findings. You're telling me laboratory findings, just give me the conclusions from why is a CT scan? It's not at this point, it's the next item. Okay, when you give me the meanings in the lab findings, just give me conclusions. White cells count is high, it means an infection, an early infection could be said. I don't certainly need the value, okay?
Okay.
That's why I got the report from the labs. Hemoglobin is normal. Until this point, you can say hemoglobin is within normal limits or is unremarkable, okay?
Okay.
Values, platelets, well, for making us assume, you can tell me hemoglobin, platelets, and everything that is normal. Albumin, all of them within normal limits or
Okay.
no enough. For example, erythrocyte sedimentation rate, use the abbreviation please, is high enough. C-reactive protein is high, it means, and then you give me the meaning about it, okay?
Okay, got it.
Sodium is low, it means hyponatremia, enough, okay? The same with the rest of the situation, okay? Similar to this, ABGs, metabolic acidosis or respiratory alkalosis. Well, of course, you have to choose one, or it could be both situations, right?
Yeah, I was doubting a lot in that. I didn't know which one was to put.
Yeah, don't worry about it. CT scan, presence of hair I'm sorry, I cannot understand this part. Can you read me the CT scan line?
Yeah, I wrote it wrong. Presence of air in the intestinal bowels.
Okay.
I wrote it
Air.
really wrong.
Okay. CT scan aerogastria in small intestine could be.
Okay.
Presence of air in the small intestine could be. Letter of referral, dear mental health intensivist, internist, well, the physician, right? Hospital A from Pablo, General Hospital D, okay. Dear Dr. Hans, I will be really grateful to see this patient who complained about abdominal pain, diarrhea, and emesis. Yes, that's great. That's the resume for taking in account the case report, right?
Okay.
You could do it for writing down the case report as a fact.
Okay.
The symptoms suggested food poisoning. Okay, could be examination with this diagnosis. When you are talking about food poisoning, could be a non-very high increase of white blood cells. In this case, they are so high if my memory is not failing at this point, but well. Examination, okay. So just 5 points, and the examination helps the diagnosis because, yes, the pain. Okay, you tell me, well, during the letter of referral, I send you specific expressions to start giving me these supports. For example, I would be grateful if you see or if you assist this patient and the patient, something like that, right?
Yes.
That's one of them, because they are common ways to give these expressions for talking in a properly way. If you find a similar expression that gets the same objective, that's great. His symptoms suggested, perfect, you give me the diagnosis. Because of my evaluation, you can say, oh, because of my physical exam. And then you support all the findings you got. Rotation. No, I should have the rotation because that's very, okay. You tell me pain during palpation and increased bowel movements. Also, he would have the rotation. There's a point, there's a line that we have to decide. Is there the rotation or not? Following the clinical findings on the tachycardia and hypotension, there is hydration with signs of shock, okay?
Okay.
Volumes and moderate to severe dehydration because of the vital signs. Enough. About dry lips and buccal mucosa could be. His lab reports showed there is an what? Can you read me this, please?
I report show there's an infection going on.
His lab report an infection going on because has high PCR and white cells count. Okay. His lab report showed, great, that's the way to start this paragraph. There is there's a new infection or an infection going on, okay, could be, because of the elevated values on PCR, WBC, or something like that. Try to use abbreviations at this point for not sending a very long letter because of the long terms, okay?
Okay.
The abdominal CT scan showed presence of air into the bowels. The same. Abdominal CT scan showed presence or showed aerogastria or showed small intestine with lots of air inside, something like that, okay?
Okay.
For all of these reasons, I decided to come to you now. Are you going with the patient or the patient is going alone? Or you are calling the doctor to check the patient? Which action are you deciding? The patient is going with the internist alone. Are you taking the patient? I mean, you're going with the patient or the doctor, the specialist is coming to you?
I saying come to you, I was telling that acudir a usted. That I was referring to that. I don't know if I.
Oh, I'm sorry, I couldn't hear you so clearly. Can you repeat, please?
Yeah. By saying I come to you, I was trying to tell yo acudí a usted. Maybe that's not the right term. Or...
No, that's not the way. Because if
Okay.
you tell the patient I come to you, it means that you are going with the patient and you are giving the speech. In
Okay.
that reason, the letter of referral is not necessary.
Okay.
Maybe because protocol could be, but at this point, no. You say, for all of these reasons, I decided to ask for your assistance.
Okay.
I decided to ask for your assistance so you can evaluate better. No, you don't have to give me you can evaluate better. If you do that, it means that you are not trusting on your own job.
Okay.
Right? You are not trusting on your criteria. You can say, for all of the reasons I decided to look for your assistance to improve the patient's situation, could be, or to look for another ways to complete this activity, something like that, okay? Better and give better answers to the patient. No, if you tell me that, means that your speech is untrustable.
Okay.
That's not the, try to fix it, okay?
Okay.
Thanks for your test. I'm going to talk about this case soon, or reports are attached. Could be the last reasons, but try to exchange some terms, okay? With regards, thank you. Okay, now, do you catch the meanings of these, the ideas I'm showing you now?
Yeah, I got it.
Okay, so try to correct it, please.
Okay.
And send me the corrections as soon as possible, okay?
Okay.
Any question until this point, Pablo?
No, I don't think so. It was so clear. The corrections I got it wrote down.
Okay, please take this in count, and during now let me see, the example of the letter of referral, did I send to the group? Actually, I'm not sure, I'm running mad.
I think not.
I think I didn't do that to the group, right? So I'm gonna send the homework file with taking in account the slides of this week and the next week for start studying. I'm gonna send a new case, clinical case similar to this, for preparing a new full exercise. This third one is for a score. And then the guidelines of the case report for checking specific expressions you certainly need. Okay?
Okay. Thanks, doctor.
Okay, so don't worry. Take all these details in count and correct it. And following the guidelines, I think it's gonna be easier. Okay.
Okay, thank you. Thank you very much.
Okay, thanks for being on time. Let me send you the poll to take attendance.
Okay.
Give me a second, please. Okay, it's there.
Yeah, I see.
Great. Diana and Pablo is for you. Elena, please give me a second.
Okay, got it.
Great, perfect. So Pablo, keep on writing down again. Don't worry
Got
about it. That's
it.
the thing we learned.
Okay.
Okay, Diana, did you catch the details I was talking to Pablo?
Yes, I got it. Thank you. Thank you for
Okay.
letting me stay.
Yeah, stay. There's no trouble on this, but I'm gonna be so. Well, with which one would be the adverb? Yeah, I'm gonna be so strict, Diana, with your job. Okay, because you got all the recommendations done. I'm gonna check them on detail. Okay.
Okay,
Now you
thank you.
own me
Don't
this
be
one,
mean.
the next one. Okay.
Yes, thank you.
Okay, dear. So please send me both this exercise too for practicing. And when you receive the corrections, then you write down the file that is for a score. Okay.
Okay.
Okay, you guys. Thank you so much. Have a great night and see you Monday.
Okay, bye-bye.
Bye bye.
Thank you, Miss. Good night. See you on Monday.
See you. Bye bye. Good night, Elena. I'm sorry I took lots of your minutes.
Good evening, teacher.
Good evening, Elena. I'm sorry I took lots of your time, but well, it was necessarily. You did get late on time, and my last feeling.
Can you listen to me? Sorry.
As I was telling you, we are going to work in a very different way together, right?
Okay.
You have to give me the explanation about situations with patients. I'm opening a file, and you should give me an explanation. Where is it? I think. You should give me explanations about how the work. To give an explanation, you and Jimena told me was not the best way to talk about it.
In what way, teacher?
They are following projecting you. Those exercises I'm gonna send to your personal WhatsApp are gonna be your evaluation in the workshop, okay?
Okay.
I think it's gonna be the way we can solve this situation, because I know it's not easy to the proper meanings while talking to a patient or acting as an interpreter.
Yeah. Yes, teacher.
Nice to
Well,
hear a detail about the explanation I was giving to Pablo and Diana.
okay. Well, I didn't listen them, but anyway, I can explain teaching in an easy way to take care about his or her health and to go to the hospital maybe and follow all the instructions, doctor's instructions maybe.
Okay, we are going to work in that way, so. And let me see, tonight I can send new exercises for you and Jimena. You both just, according to that, we can solve this, okay? We can find a way to make it in a better way for helping you and practicing the specific vocabulary. I mean, could be filling blanks, matching columns, something to support, okay, the worker job.
Okay.
Okay, I sent you the slides. Did you get them?
Right now?
Oh no, I sent you yesterday or today, I'm not sure, the slides from the classes of this week. Did you get them, both of them? I mean 13 and 14?
More or less, more or less.
Okay, try to read all of this information, check the details, and please let me know if there is a trouble or something that we should practice again, okay? Or maybe memorizing new vocabulary is not so clear. Please let me know in order to give you an extra explanation and correct this situation, okay?
Okay, well, as I said, for me it's hard because I'm not a doctor.
Yeah,
But I try to understand. I know that this is new for me. So I know that I have to know more about medicine and a lot of things. But anyway, it's a good experience to know another subject, not only English, but also an specific things about medicine, something like that.
yeah, thank you. Thanks for being with that perspective. We are going to improve this, don't worry about it. We are going to find a way to, well, I want to exchange objectives in your final test, because in this final test, your colleagues, well, the doctors, your classmates, have to support with medical knowledge.
Yes,
In
yes.
your case, I have to change lots of questions for the final test because it's out of objective to send you information.
Okay, but
Yesterday, we were checking ways to ask for a specific information, family, in, I don't know, medication, things that are so general at this point. That parts you have to know, right? How to make a
yes,
specific question.
please. Yes, but anyway, I am learning a lot of things about some procedures, some illnesses, and well, it's interesting. But anyway, I know that I need to learn a lot of vocabulary and a lot of things. But anyway,
Yeah,
I'm going to
about,
try to do so.
okay, what about the statistics? Does this topic fit to you for taking the test? We're talking about weights, scales, pie charts, line charts. Is it possible to work with them?
It's hard for me. This it's very hard. I prefer to learn about some procedures because I understand when I imagine that I'm as a patient in front of a doctor and I remember some instructions, some
Okay, I got it.
yes, but skills and that, well, I don't know. I'm honest. It's hard for me because I don't understand exactly.
Okay, great. I got it now. In the way we are talking now, I'm gonna exchange the final test for you and Jimena because you both are almost in the same situation about this new vocabulary. Her
Yes, please.
question so hard. She told me she was so honest with me the situation, same like you. So don't worry. I'm gonna I'm gonna fix it. And well, the homework file is for practicing. It's gonna be a step for being prepared for the final test. But questions for you and him are gonna be different, okay? Don't worry about it. I'm gonna find a
Okay,
way
thank you so
in a
much.
better way in order to help you, okay?
Thank you, teacher.
Okay, Elena, let me send you to take attendance, okay?
Okay,
Okay, can you watch the screen?
yes.
Great. Good night, Dorian. How are you? How was your day?
Good night.
Okay, I send it.
Okay, thank you, Elena. So see you Monday, okay?
Bye.
Bye-bye.
See
See
you.
ya.
Bye. Bye.
Okay, now we are together, Dorian. Hi, how are you? How was your day?
Was okay, yeah, I think.
Okay, it was possible to make, man.
What?
It was possible to make. Well, I mean, it was a good day, I think.
Oh, kind of, yeah, kind of tough, something like that.
Okay. Well, patience, it happens. Okay, Dorian, let me see. Did you have enough time to write down the exercise I sent? Okay, report, physical exam, labs, everything.
No, I couldn't. Totally forgot it. Was not able to make it either.
Okay, no worry. I understand you are in a very busy moment with the university too.
Yeah.
So
Sorry about that.
don't worry, I understand the situation. It's not easy at this point. We got lots of activities here, and with the university,
Yeah.
of course, it's not as easy as it looks.
Yeah.
Let me show you the letter of referral again in order to follow the details, okay?
Okay.
Okay, so let me share a screen. And yes, can you watch my screen?
Yeah, I can see it.
Okay, great. Nom, 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 nom. Let me fix the detail. This is the guidelines for the letter of referral that I forgot. Certainly, now I realize I forgot to send it to the group. But now we are here anyway.
Yeah.
We got this chart as an example. If you remember when we were talking in endocrinology system, we got this example about letter of referral. And we have some, that's that example how it works in the first two paragraphs. But going with this, you got actually all of this space to fill 8 steps to complete all the information you got. This is a basic letter of referral, of course. Not so hard to do it. It's very easy to make while practicing, while doing the case report and everything. Of course, there are some details in different letter of referrals. For example, when we talk about an intensive care unit patient and we send a letter of referral, we add lots of details in different places. It's out of objective now. Or if you got a social situation because your patient is, I don't know, without a job or is homeless, you got extra details to add, but it's, at this point, I think it's not as important as writing down the easiest, the best one, the most common, okay? You got the place and date, okay? I mean, fill the name, specialty and location of the doctor you are expecting assistance and your information like this. We got it, right? To doctor from me, something like that, right? The polite expression, the dear doctor, for example, is the best one, following experience, is the most common way, and in my opinion, the kindness, a sweet way to start writing down, because as I was telling you during the class, it shows your confidence with the doctor that you are looking for. Okay, this confidence is so important because you can support that the job of this specialist is important for you and they feel better. Here in Bolivia, you are going to notice while getting in 5 or in 4th year, when you send a letter of referral, well, you have to be so clear in the form you are filling. And during the speech, you support the diagnosis and everything, and they decide if they can assist the situation or not. It's a very common situation in all places in Latin America, not just here. But it's not correct. As much you learn, it's better to stay humble, right? In that way, This expression is very important in English. Never forget it. Not just says, for example, Dr. Arenas, please, or Dr. Arena, Dr. Anyway, Dr. Camera, and then start with the speech. No, always, dear doctor.
Okay.
Introduce the case with this kind of expression, making the requirement of the case always. By experience, I never read a different sentence at the beginning as an introduction. Never. I never got this opportunity. That's why I like to show this. I would be grateful if you would see this and then you introduce the general data of the patient. This is a very great key. Then introduce the general information from your patient, similar to the case report. You know how to make it now. And start supporting your complaint, the complaints and medical terminology, okay? I said here, it's the best way. Why the best way? Because you are talking in the same language that the specialist, that the colleague. And when you give a medical term, it's understood that you realized the symptoms, the common expressions into medical expressions in the sense they got following the protocols. That's the best way of this. Of course, we have to follow the correct terminology, the correct events, the chronological events, and using connectors to make a nice paragraph. Right, easy, similar to when we write down the clinical, the case report, right? The second paragraph, giving the diagnosis. Always, you finish complaints and always you start supporting the diagnosis you found following your own experience. Here in Bolivia, we make it in the opposite situation. You start supporting everything as a resume for the medical history. And at the end, you add diagnosis. In English, is the opposite, as I was telling you. It's not in that way. You give me general data, you give me the complaints, the history of the patient, and then you support the diagnosis following your experience, okay?
Okay.
This is always in the first sentence at the beginning, and then findings, lab tests, just the most important conclusions, and imaging tests. Talking about conclusions of them, not all the report, same as we were talking yesterday, right? Finish the letter of referral, giving a polite farewell could be. And the best way, thanks for your assistance to these patients. I hope we can talk about this case in some days. That's a good way. Moreover, all the reports are attached. Well, same as yesterday. If you find another way to give me the same information, perfect, it's welcome. Okay? So don't worry about it.
Okay.
Just try to write it down and then you got an example how it's done. That's the answer of the one you have to. Oh, well, that's the example we got with Joseph Jones, the retired patient with urinary tract infection and hyperplasia, prostatic hyperplasia. We only need the biopsy, but it has to be developed by the urologist. We cannot do it because the GP has not this capability because of loyal purposes, right? As you can see, we make everything, and with everything done, the patient has to go to the specialist. You don't have to set anything by free. Is the opposite in Latin America. In Latin America, you can get just clinical features, maybe 1 or 2 labs, not everything. And then the specialist, when receives the case, prepares all the information, checks the clinical history, talks to the patient, they can add basic studies that should be taken in your time. That's a difference. You have to follow always protocols and complete the full protocol previous sending the patient to the specialist. Okay? So, and here you are supporting what you made with this patient because it's a pathological situation, what you know about it. Yeah. Any questions at this point? Any doubt how to make it?
Not really, just maybe related to the terminology. We got to be use. I mean, we have to write in a formal way, right? Like,
Yes, yes, it's in a
yeah.
very formal way. I think it's gonna be
Okay.
easier for you because you told me you write down essays, right?
Yeah.
Yeah,
I've
it's gonna
learned
be
some.
yes, it's gonna be
Okay.
very easy for you to complete this part of the job.
Okay.
Okay,
Yeah.
great.
About that. Yeah, finding and about the findings, like we got, I saw like from the example you just showed me, there were like three findings or something related to the case. Is it the maximum, the minimum, or we can add as much as it is found, like in the example? Is there
Okay, here, for example, we revealed all the findings. This one?
oh no, the reasons for all the reasons. So it's not that difficult, I think.
Oh,
Just
this, for all of the
wait.
reasons I decided to. Well,
Oh
in
yeah.
this part, it's according to the situation. If you got
Okay.
the patient admitted into the hospital,
Mm-hmm.
well, you tell me that why he is into the hospital. This patient, because has to start antibiotics, right? And you
Mm-hmm.
just mention which antibiotics are. You don't have to give me doses, frequencies, anything, or the schedule of medication.
Mm-hmm.
It's not important because we got the universal treatments as a rule, right?
Mm-hmm.
You only tell me how many doses the patient is receiving until this point when you send the letter of referral. In this case, 3 doses. You decided to send the patient to home to discharge the patient and giving oral medication. You just tell me which medication is receiving. That's enough. It's
Okay.
according to your own experience. Sometimes, for example, if it's an appendicitis, you cannot send the patient at home, right?
Yeah.
Patient has to be admitted in order to receive treatment. I mean, according how complicated is the situation, you only have to wait for the surgery time, but you have to prepare the patient. You can start IV fluids, maybe some analgesics, maybe if you consider necessarily, and if following the lab reports it's necessarily, you start antibiotics. Maybe we got a peritonitis following the appendicitis, right? That's why it depends on the situation. If you got, for example, a pneumonia, non-complicated pneumonia, because of all the situation with the patient, you usually
Mm-hmm.
discharge the patient at home, and then you make controls every 2 days. In that
Oh,
way, you decide, or you can send the patient to the pneumologist, but with oral medication. It's a way to work on this. We got,
okay.
for example, one scale to decide which pneumonia has to be admitted and which one has to go home is the CORP 65.
Oh yeah, I remember that.
Yes. Following this easy scale, you decide and you take the decision supporting on this evidence scale, right?
Mm.
With this medical evidence, nobody has a reason to fight with you about your criteria while doing this. That's why
Okay.
it depends. It depends. For all of these reasons, I decided to, and then you tell me, I decided to send the patient, or I decided to, for example, if you don't give anything and prepare that the doctors goes that moment to the emergency room, for example, to evaluate the situation. For all of these reasons, I decided to call you to ask for your assistance now, because the patient has a very has a complicated situation, supported by labs and physical findings, for example.
Mm.
Now doctor knows that it's an emergency and has to go at the moment, or because this treatment is under your own manage and dosage, I prefer to send you the patient for checking these details, of course, with all the labs for not wasting time. Could be when you talk, you can do it without medication, sending a patient without pill. Is because, for example, in hypothyroidism, when we have to consider lots of details, previous to starting the oral medication for making the supply. Okay, it's according to the situation. That's why it could change.
Okay, my bad. Okay.
Yeah. Okay, Dorian, I sent you the poll to take attendance. Can you watch it?
Yeah, I can see it.
Okay, perfect. Hi, Laura. Good night.
Hi, teacher. Good night.
Okay. Okay, Dorian. So
Yeah.
try to write it down and practice. Tonight I'm gonna send homework file, a new writing exercise similar to this one. This new writing exercise is for a score. And now I'm gonna send the guidelines of the letter of referral for catching the support of this, okay?
Oh, okay.
Okay, so have a great weekend. Don't forget that next week we got the final test of module 2, and then everything is...
On Tuesday, Thursday, right?
Yes, on Thursday.
Oh, okay. Okay.
Okay, great. So any question, please let me know by a message. Don't worry about it. There is no problem on the schedule, okay?
Okay, thanks a bunch. Bye-bye.
Bye-bye. Okay, Laura, let me see.
Hi, teacher.
Hi. Did you have enough time to work on the exercise I sent yesterday?
No, teacher. I read it, but I was full of work and I can't do it, teacher. Maybe I can send you until midnight, please.
Yes, as soon as possible. If you send me the answer tonight, is gonna be the best way because I'm gonna send homework and a new file for practicing, and now it's for a score. This one is for catching mistakes and correct sentences. Send it to me
teacher.
as possible for making you the feedback, and then it's gonna be possible to make the exercise for a score in a proper way, in the best way, without mistakes, okay?
Okay, teacher, thank you.
Okay, in that way, let's work the same I was talking to Dorian. Let's check the guidelines about the letter of referral, okay? Okay. You remember this chart? We were talking with this when we were into the endocrinologist class. That was the example about the letter of referral, just this box showing us the introduction and a little part of the second paragraph. But now checking details and considering that, of course, it is not a complete job, I prepared this information, these 8 steps, for writing down a basic letter of referral. I mean a basic because it's the easiest one. You introduce a patient, talk about the specific situation you are taking on, and then you finish this. You are not giving me pathological antecedents, social history, family history, nothing like that, because at this point, it's not necessary to do it in that way. According to the situation, you decide if you need to add that information. But it's a mess. That's why I prefer not to work in that way. We are using the common one, okay? As I was explaining in previous classes, we write down a letter, literally a letter. We use the place and date, of course. We fill the name and specialty and location of the doctor that you are expecting, the assistants, and your information like this, to specialty and where the doctor is working on, from, of course, your name, your specialty, or if you are still a general practitioner and the hospital you work on, as an example, right? Number 3, start with a polite expression. Always, dear doctor. Try to be kind, try to be nice. in UK, USA, that's the best way for being polite and show that you really trust on the doctor's job. Okay?
Okay, teacher.
If the specialist finds that you are trusting on him, everything works better. Tell you by experience. They don't feel so high. Well, not all of them, just some, but they are not too much. Not like here. If you tell a specialist, dear doctor, they run mad. They think you are being impolite. I don't know why. But in some other countries, that kind of a specialist keep on being humble. It's different from here. There are just cultural reasons.
Yes.
Okay. And then introduce the case, introduce the patient situation with a second kind expression. Okay. I would be grateful if you would see this. That's a key sentence, a golden way to start talking about it. Because it shows that you certainly trust the doctor and you consider that there is no one better than him to come to treat this, right? It's a very nice situation. Imagine someone that is asking for your attendance with this or for your assistance with this. Well, you feel great, right? You feel good.
Yes.
That's the objective. If you see this from this point, it's almost a copy from the case report, the introduction you use here about general information, and then supporting the complaints in medical terminology, always. Why medical terms? As you would notice, there are some synonyms, right? In that synonyms, according to the pain explanation, or to the patient explanation, the meanings could change and convert the situation in a very different pathology, I mean. That's why using medical terms, you are directing the medical thought, and it's easy to talk properly about the case, okay?
Okay.
That's the best way, okay? Following the correct chronological events. There's no way to say, but at the beginning, no, try not to exchange or to mix the ideas, okay? Then start the second paragraph, always giving the diagnosis. Always, don't worry about it. If you got 2, 3, 4, 5 diagnoses, don't worry. Give me the list of pathologies and then start supporting one by one with the labs, with imaging tests, okay? Start supporting complaint, blah, blah. Okay, when you got the findings and the lab tests, just give me the most important conclusions, no values, no numbers. There are not necessarily, because you are attaching these files. The specialist can go to that place and check if he's feeling that something is not so clear. Okay. And imagine tests, talking about conclusions from them, not all the reports as we were talking in the previous workshop. If you got, ultrasound, CT scan, and X-rays, which one is the first imaging tests to be reported?
RM?
Which one?
Or I don't know what you talk about. I forgot the word in English, teacher.
Tell me, don't worry.
Resonancia magnética?
The MRI.
Yes, MRI.
No, actually, when you support the imaging tests in general, you have to give me an order of this one. It's not by free to talk me about MRI, then X-rays, then CT scan, and at the end ultrasound. That's not the way. Sometimes when we receive patients that certainly need all of these studies, because of the situation, certainly supports this. You at the beginning talk about X-rays. X-rays show and then give me all the details you find in all the pathological views you got. Then you go to ultrasound. Same, you talk about conclusions. Finish ultrasound, go to the CT scan. Same, just conclusions. And then at the end, the MRI. That's the order to give me this information in the letter of referral, okay?
Okay.
Try not to change it, because if you exchange it and mix the details, no, it's not correct, because you are showing me conclusions in this letter of referral, right? You're not giving me all the chronological activities we developed with the patient, right?
Mm-hmm.
At the end, finish the letter of referral, giving a polite farewell, okay? An example, thanks for your assistance to this patient, and a very common expression. I hope we can talk about this case in some days. It still is showing the confidence you got with the specialist, right?
Mm.
That way, this answer, in my opinion, is one of the best ones to support that you agree on his job and you are so open-minded to receive corrections or to be taught. Okay.
Okay, teacher.
And then, moreover, all reports are attached to this file. If they get a copy of all the reports, all the conclusions, well, everything about this lab tests, imaging tests, well, you don't need to write down everything. They have the obligation to go and check if they want to support anything, right?
Yes.
Okay, there's an example we were checking. And there's a detail. This part, for all of these reasons, I decided to, according to the situation, you can talk about the treatment you started or why the patient is already admitted into the hospital, right?
Mm-hmm.
It's your choice. Or maybe you can support why you preferred not to do anything because the patient certainly needs at the beginning the specialist evaluation. And according to that findings, the specialist has the chance to start from zero all the attention, all the assistance. Okay. Did you get this part, this idea, right?
Yes, yes.
Okay. Any question until this point?
No, teacher.
Everything clear?
Everything clear.
Great. In that way, let me send you the poll to take attendance. And let me tell you that, well, this information, well, tonight I'm gonna send the new writing exercise. This new one is gonna be for a score. It's already done. I promise I'm not gonna fail on this.
Okay,
moreover, yes, I'm running mad. Well, actually my kids are better, so I think, well, they are without fever. That's the best part. So I think
yes, teacher.
Work with more time and prepare the files in the correct way.
Okay, teacher.
Then,
no worry.
Thank you. I'm gonna send tonight the exercises from this week and the next week, similar to the previous test, in order to start to study, checking the information, because without time, it's not correct to send you the presentations, right?
Yes, teacher. It's okay.
This homework file, of course, is gonna be until Tuesday, because you need more time to prepare all the answers for these 4 presentations. It's a not too long homework file. It's possible to make it. And well, the new writing down exercise. This new one is for a score, and don't forget to keep on reading because, well, next Thursday in a week is gonna be the final test, similar to module 1, 2 hours for lasting this test. And well, you know, on Friday during the day, I think I can send all the homework, all the scores from the test and all the job during the workshop, okay?
Okay, teacher.
In your case, I didn't, well, we don't have absences, right?
No,
You're
teacher.
the student, the only one who got this fact. Your classmates, well, at least got one absence. Well, the 100 score for this chart is not here. Yeah, don't lose this. It's very
No,
important.
teacher. Yes, I know it.
So thank you so much for taking in count, for coming properly and practicing. Okay.
Okay, teacher.
Till this point, everything clear?
Yes, teacher, everything clear.
Perfect. Thank you for your answers. And well, that's all.
Thank you, teacher.
Okay, have a great night. And please send me the writing exercise, okay? I'm gonna check
Okay,
this,
teacher.
give you the feedback during the day of tomorrow. And following the feedback details, then write down the new writing exercise, okay?
Okay, teacher.
Okay, so have a great weekend. See you Monday.
Thank you,
Okay?
teacher. See you Monday.
See ya. Bye-bye.
Bye-bye.
Okay, tonight just 5 students came, but well, it's their decision, it's their fact, it's not mine. So patience and well, anything, I'm here. Yeah, I'm gonna send the file as I was telling, and that's all.